For those of you joining us, welcome to the Danville Town Council meeting, and our meeting will begin shortly.
Looks like my background is backwards.
It looks correct for the viewers.
So good evening, everybody. It is 5 o'clock right now. This meeting is now called to order. Welcome to the Tuesday, March 2nd, 2021 Town Council meeting. Prior to beginning our meeting, I would like to mention protocols in place for the coronavirus and meeting procedures. On March 19th, 2020, the governor issued Executive Order N-33-20, ordering all residents in the state of California to shelter at their place of residence. Therefore, members of the town council, the town staff, and the public are participating only via teleconference. Currently, there is no physical location available for us to meet in person. Although this restriction has been put in place, we encourage our citizens to participate in all of our public meetings. If you wish to participate in this evening's Zoom meeting, you can participate in one of two ways. Zoom, which will be verbal comments. To provide live comments during the meeting, the agenda items will be announced and the agenda item will be open for the public comment. Simply click on the raise your hand in the Zoom to be called on. Your name will be announced and you will have up to 3 minutes to share your comments. You can also email our city clerk, Marie Sanseri, with your written comments. To provide written comments, you need to send your emails in prior to 11 a.m. the day of the meeting. Written comments will not be read into the record. Please visit the website for more information on that. Marie, would you mind doing the roll call this evening?
Yes, thank you. Councilmember Fong? You're on mute.
Here.
Okay. Councilmember Stepper?
Here.
Councilmember Storer?
Here.
Vice Mayor Arnerich?
Here.
Mayor Morgan?
Here.
All council members are in attendance. For those of you joining us today, I am Danville City Clerk Marie Sanseri. We are also joined by Danville Town Manager Joe Calabrigo and City Attorney Rob Ewing, as well as others who will be presenting today. Thank you.
Marie, are there any announcements this evening?
I believe you covered that. Thanks, Mayor.
Okay, just wanted to double check if I missed anything. Number two on the agenda is the Pledge of Allegiance. And this evening we are lucky enough to have our Chief Paige Meyer with the San Ramon Valley Fire Protection District joining us, and we'll be presenting later on in the agenda. And I would love to have him lead us in the pledge this evening.
Yes. Thank you, Mayor. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. This evening, I'd also like to ask if there's any changes to the order of the agenda.
No changes to the order of the agenda.
Thank you so much. Item number 4 is for the good of the town. This is an opportunity for members of the public to address the town council on items that are not on the agenda. Are there any members of the public that wish to address the council? Marie?
I do not see any hands raised to speak for the good of the town.
Okay, fabulous. Let's go on to number 5, presentations and proclamations. We'd like to bring on the presentation of a proclamation to Patty Hoyt. Is Patty here? Patty is
Yes.
here. I see her. Hello, Patty. It has been so long since we've seen each other in person. It's so good to see you. I know that your work has not stopped since this pandemic has started, and we thank you so much for all your efforts that you have worked with our children and done so much. So we would like to present you this evening with a proclamation from the town of Danville, being that it's 2021, the Prescription Drug Abuse Awareness Month. So if you don't mind, I'd like to go ahead and read that proclamation to you now. Whereas in 2019 in Contra Costa County, there were 565,236 opioid prescriptions given to patients, which is an age-adjusted rate of 417.1 per 1,000 residents, higher than the state average of 400.6. And whereas according to the Center for Disease Control and Prevention data, among the 70,630 drug overdose deaths nationally in 2019, 49,860, which is 70.6% of those deaths involved opioids, and 91 of those opioid-related deaths occurred in Contra Costa County. And whereas it is estimated that the economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including a cost of healthcare, lost productivity, addiction treatment, criminal justice involvement. And whereas the national prescription drug take-back days have turned in nearly 13.7 million pounds of medication since the fall of 2010 at take-back sites available in all 50 states and the U.S. territories. In Contra Costa County, during the last prescription drug take-back day in October 2020, 1,366 pounds of unwanted or unused prescription medications were turned in. Now, therefore, be it resolved that the Danville Town Council does hereby declare March 2021 as Prescription Drug Abuse Awareness Month and encourages all citizens to participate in prescription drug abuse-related prevention programs and activities, and to spread the word, one pill can kill. In witness whereof, we have hereunto set our hands this second day of March 2021, and it is signed by the entire council. Thank you, Patty, for being here this evening.
Thank you very much. As always, the town of Danville and all of you here have been great support in our prevention efforts to reduce prescription drug use and illicit drugs use on top of that. So we really appreciate your support. As you know, I work at Discovery Counseling Center, but I'm a board member of the National Coalition of Prescription Drug Abuse, and I'm here in that regard. However, we do know that during COVID, mental health has been a big concern, as well as overdose deaths. They've increased at an alarming rate. And while in that proclamation, so many of the numbers were from 2019, we can only assume that they're going to look that way or worse for 2020, sadly. So that's why the work we do is so important in bringing community education out there so people are aware about this and know that there's alternative treatments to opioid use, that there are safe ways to get rid of your medications, as we talked about in the proclamation of take-back days. One of the things that we are out there doing is providing naloxone or Narcan, which is an opioid overdose rescue drug, and it takes away an overdose of someone if you're able to administer it. And we're out there providing kits free of charge. You just takes a short training, and I think I've been here before offering them to any of you, because honestly, you never know who's going to be overdosing, because right now fentanyl, which is a very, very dangerous opioid, is showing up in things on the street that you wouldn't, that don't normally have that. People are buying pills off the street that have fentanyl in them. They think they're getting a Xanax, and it's actually got fentanyl, and people are overdosing. So having these rescue kits out there in as many hands as possible is really valuable. And just as a way to get them is you can go to www.ncapda.org, and that will give you some information. And we also have a YouTube channel where we have youth ambassadors that have been out there doing lived experience interviews with people who have had the experience of overdosing or unfortunately of addiction. And it's really a wonderful, wonderful resource to hear about how people are surviving this and the help that education has given them. So I thank you very much for this honor again, and it's really nice to be able to see all of you, so to speak. So I really appreciate it. And welcome to the board, Councilmember Fong. Thanks. Nice to see you.
Absolutely.
So Patty, I also wanted to tell you that I honestly miss the fairs and all of that put on, and I have my kit. I carry it around in the car with me.
Good.
Do they expire as well? So do we have to renew them on a certain amount of time as well? So to make sure that they are current?
It's about a 2-year expiration, although I think that we're finding that that's not a true expiration date so much like so many things, that it's a date that you should replace it, but it's still viable after that date. So it's about 2 years though. Yeah.
Great, thank you. Karen?
I just wanted to make a comment. It's always an honor to have April Romero joining us as well. And it's great that both of you come to these meetings with us, because we so appreciate, that you both have seen these things in person, and it's been hard for you. And we want to give you support from all of the council. Thank you.
I wasn't sure that you could see that April was here, but yes, she is.
Robert?
Great, Patty, thank you as always. We really appreciate the relationship with Discovery and you and all that you do in our community. You're with the partnership with the police department, the fire department, town of Danville, chamber, really good relationship. And I appreciate all your good work. Nicely done.
Thank you.
Dave?
Yeah, Patty, thank you. And thanks for joining us. And thank you for all of the great work you're doing. Being a pharmacist and being involved with this crisis, and it truly is a crisis. I can't, really say what I appreciate when it comes to people willing to step up and deal with addressing this. I don't even call it a pandemic. I call it really an epidemic. And, as a pharmacist and being a gatekeeper for medications, we have to balance, and we do it every day, between ensuring patients get relief from the meds they need versus how do we simultaneously protect the public from drug diversion and abuse. And so there is a lot of education, and we can't just say it's bad or it's good. There is that balance. There are those gatekeepers, but your engagement and involvement only helps spread the word and enhance the communication that's necessary that hopefully keeps the bad players off the street, keeps the bad drugs off the street, and most importantly ensures that people who are rightfully entitled to the right drugs for the right reasons are getting them as well. You've got our commitment. I know our profession has committed to remediating this crisis, and I can't overemphasize the availability of naloxone and making it available and having it available because you never know. There is that day, there may be that day, and being trained and understanding how that product can truly make a difference in saving lives. I can't over highlight that point. But again, thank you very much.
And thank you for that, because it is, I meant to say that naloxone, while we distribute it, it is available at pharmacies, and anyone is able to access it through a pharmacy as well. Absolutely. I forgot to say that. Thanks for that reminder.
Mm-hmm.
Newell?
Patty, I just add my thanks, as well as being board member at Discovery, knowing the number, particularly of young people that we have seen over the years. But as you know, the good news is all of our police have the kits in their cars, the schools have those. And as you said, that is free to anybody. And it doesn't take more than a few minutes to know how to use one. But it is so striking and so devastating. Another statistic is there are more people that die every year over the past 9 years in the United States from opioid overdose, mostly Oxycontin, from one company, per year die than the entire loss of life of US soldiers in Vietnam over nearly more than a decade. That's how devastating it is. And it's, in theory, gotten better, but as Dave said, as a pharmacist, when Oxycontin came to the marketplace, it seems, based on all the lawsuits, it was a drug that was more addictive. And when the prescriptions were set that you could only get 30 as a minimum, and it only takes 20-something pills to become addicted to it, that was a destiny to failure and death. It is just absolutely criminal. And it's taken efforts by you, the organization. Some towns are just absolutely devastated that they can't even find people in their small communities that can pass drug tests because it's been so so overwhelming in some communities that you've seen that's been on 60 Minutes and all these other shows. So again, thank you, and to April and all of you who advocate on so many levels, and a new thing comes up and it becomes the new thing that we have to advocate for. It's sad, but thank you so much for your work.
You're welcome.
Thank you, Patty, for being here this evening. It's so wonderful to see you. Keep up the great work, and we look forward to seeing you real soon, hopefully in person sometime in the near future. Thank you for being here this evening.
It looks like we do have two folks that have raised their hand to speak.
To Patty, in reference to this proclamation?
We have a speaker, Charlie, who would like to speak on this item.
Okay.
And I am going to share my screen and start the timer.
All right, well, good evening, Mayor, Vice Mayor, and council members. My name is Charlie. I'm one of the youth ambassadors with the NCAPDA. I've been serving with the NCAPDA for around a year and a half now. And, I'm just really grateful to be given the opportunity to speak on the opioid epidemic today. And so in my year and a half of involvement, it's just really opened my eyes to the gravity of the situation in communities just like ours. So I've gotten the chance to speak with those in recovery from substance use disorders, and the lessons they have to share are just so important for youth and adults alike. I think it's really important that we're all aware that to this day, doctors are still overprescribing opioids and medication by exorbitant amounts. And so we really want to let everyone know that if you're recovering from a sports injury, a root canal, or a surgery, really just benign things, you only need a fraction of what's prescribed to you. And in the event that you do go overboard, you take more, you really do run the risk of potentially developing a substance use disorder. And so, so I think Patty mentioned the lived experience interviews that we've conducted over the past year. And one of the amazing things about that, it's just really opened my eyes to some of the real experiences with people who've gone through a substance use disorder. And I think it's just crucial that people really have an idea of what's put on the line the second they get hooked on opioids, your passions, your relationships, your education, potentially even your life. And so, you look at all these things, maybe you're just like recovering from a root canal. It's such a benign little thing. And it has the potential to push you into downward spiral where you get hooked on opioids, you transition to meth, heroin, even harder substances. So everyone just needs to be really cognizant. And that's really our mission here at the NCAPDA, to ensure that more members of the community are prevented from getting hooked in the first place. Because ultimately, the more educated we all are, the more resilient we can be against this epidemic. And so if you're a student who, like me, is interested in the cause, really please check out our website, ncapda.org, for more information on how to join and ultimately become a driving factor of change in your community as well. So lastly, I would just really like to appreciate the efforts of the town of Danville that we're taking to recognize March as Prescription Drug Abuse Awareness Month, because it really helps us reach a broader audience than we might reach otherwise. So thank you so much.
Thank you, Charlie, so much for being here this evening. It is so wonderful to hear that our youth are so engaged with this and are so aware. And thanks to people like you, the youth can relate to you. And so we so appreciate you being involved. Thank you for being here this evening as well. And Marie, you said we had one more speaker?
We have two more speakers. The next speaker is Brian Walker.
Okay, Brian, you also have 3 minutes. Welcome, Brian.
Thank you. I just wanted to request contact information for Patty Hoyt and Discovery Counseling.
Okay, we'll be sure to get that information to you. We could probably put that on screen, so watch for that.
Thank you.
You're so welcome. Our next speaker is...
One moment. April Rivero.
April is here. Good evening, April. We're so happy to have you here this evening as well. You have 3 minutes as well. Good evening.
Good evening. Thank you so much for the opportunity to share just a few words. Thank you, Patty and Charlie, for really recognizing the work that we're doing and making sure that everybody's aware of how important this issue is. So thank you first for issuing the resolution, but the add-ons I'd like to share is during this month, we do everything we can. I mean, we're always out there working, of course, but especially strongly during this month of March, which is Prescription Drug Abuse Awareness Month. And so I just want to make sure that you know that we have a lot of activities planned. We have naloxone training. We have a session just for seniors and their caretakers. We're doing stuff for youth that is in cooperation with the Key Clubs over in Walnut Creek at 2 of the schools there. So there's just a lot of activities going on, and we just want you to visit our website, take a look at what they are, and hopefully participate and share that opportunity. Also, I want to ask that you all remember us after this month, and where you know that there are opportunities or you uncover them where you think we might be of service, please contact us. Let us know how we can, give additional presentations to youth, adults of all ages. We're always here and very anxious to help out. And none of our services do we have a charge for. They're always free. So we find a way to raise funds to enable that to be the case. And all of us work as volunteers. So our overhead is pretty small. And then Dave, I would really love to connect with you. I didn't realize that you were on the council, and would really love to hear how we could maybe collaborate with you as a pharmacist too down path. So thank you very much again for recognizing the month. Appreciate it very much.
Thank you so much, April.
I brought back Patty Hoyt so that she could just quickly state her contact information.
Got it. And she also put it on screen. So thank you, Patty. I appreciate that.
Yeah, I didn't know if everybody can see the chat or not, but it's Patty Hoyt. My name's here. It's all one, Patty Hoyt at discoveryctr.net.
Okay. Thank you so much.
You bet. Thank you all.
Okay. Oops.
There's our beeper. Are there any other speakers? All right. Seeing none, I guess we're back here to the big screen. So we must not have any more. So thank you so much. It's such an interesting cause, and also April having firsthand knowledge of how this can affect us personally in our own personal lives as well. It's a very, very heartwarming story. At the same time, it's also something that we should all be aware of. Item 5.2 is the updates from the Fire Chief Paige Meyer and the San Ramon Valley Fire Protection District. Welcome.
Thank you. Thank you, Mayor Morgan. Quickly, I'd just like to thank the Discovery Counseling Center. They do great work. And all the work that they do really does make a difference for us when we're out on the front lines and dealing with some of these cases that you talked about. So great job by them. Also like to take a moment to welcome Councilmember Dave Fong. Welcome aboard. I'm sure you got your welcome already, but from us, it's good to see you and have a new face. And as always, with all the other council members, it's great to see you and Joe Calabrigo. You're probably sick of me, so I'll leave it at that. But in any event, thank you so much for having us. It's an exciting time for us with the vaccine and the COVID issues that we've dealt with over the last year. And we thought it would be important to share with the town and the council the work that we've been doing behind the scenes. I know you've probably gotten a lot of feedback about what's happening in our community. You probably have questions, and we thought we've been out there. On our website, we put things out on social media. We try like heck to get every message that we can get out to the community and let them know how things are going. But this sometimes is a great medium for us. So we appreciate the opportunity to at least do a presentation and bring you up to speed as to the things that we've been working on, which we're really proud of. With that being said, I don't see, as my staff was going to introduce them, but they're not popping up on my screen. Oh, here they come. Okay. And okay. So of course, you know, Jim Sullivan, Deputy Chief, he's assigned to Danville. He's your assigned Deputy Chief. We have our Emergency Medical Services Coordinator, Laura Began, who's been doing a lot of work in the EMS division. And then I think we have Chief Jonas Aguiar, Battalion Chief. We'll see if he pops up. Knowing my luck, he won't. But we don't need him till the second half of the presentation. But he will jump in, I'm sure, at some point. So this is your team. Here he is, Chief Aguiar. So what we'd like to do is share the screen, do a presentation, and kind of go through, really focus on what we've done as far as vaccines go. I know that that you have all heard about the push of vaccinations in the county. We've been a big part of that. We got involved early on, and that was not by accident. We knew that it was important that we got to the front of this pandemic, and we're a part of fixing the problems. We're strategically located throughout our district. We're aggressive. We have firefighters that are used to big fires and different things. So for us, it wasn't a big issue. So we wanted to be out at the front, and we wanted to be a part of the solution. So what we'll do is we'll present some slides to you, go through specifically how things went and how things are going. But I would just like to add one thing. I'm really proud of this group. They've led a lot of folks that they'll talk about, both within the district and volunteers, and many folks that you know that have stepped up and volunteered right from the town of Danville. So we'll talk about them, but it's a team effort, and very proud of them, and want to give them a chance to go ahead and present. So I'll turn it over to my EMS coordinator, Laura Began.
Thank you, Chief Meyer. Good evening, Mayor Morgan, Vice Mayor, and Town Council members. Thank you for having us. We're certainly excited to be here and share our COVID-19 response vaccine clinic initiative with you. A brief overview of our presentation. We will be reviewing Contra Costa County statistics, our own San Ramon Valley Fire Vaccine Initiative, and then finally our fire district next steps. Just prior to the holidays, our county began to see a sharp rise in COVID-19 cases, thus forcing us into the purple or highest risk level from orange, completely skipping the red tier. Due to this sharp rise in cases, on December 6th, a state and county-wide stay-at-home order was implemented. In mid-December, we received the long-awaited news that we had 2 vaccines, Pfizer and Moderna, that were given emergency use authorization by the FDA. Following nearly 2 months of vaccinations to our Tier 1A group of healthcare professionals, first responders, and followed by elderly ages 75 and older, on February 1st, we began to see a downward trend in our COVID cases. Potential other causes for this downward trend also may be attributed to the end of the holiday season, which promoted large gatherings, and a noticeable compliance with wearing masks and social distancing. As we have seen over the past few days with the surrounding counties, our surrounding counties moving into the red tier, it is our hope, and according to Dr. Savelli, our public health officer, that Contra Costa County may move into the red tier by mid-March. This next slide highlights the COVID-19 cases and vaccinations within our fire district. I'm going to go into detail for Danville on the next slide, but I would like to draw your attention to the column cases last 14 days. Please note the green total of 122, indicating the drop in cases in the last 14 days. To put this into perspective, we gave a presentation to our fire board at the end of January, just 5 weeks ago, where we reported 427 cases total and 147 cases for Danville, which equates to a drop of 98 or 67% reported cases in the last 14 days. So as you can see, the downward trend is happening. Moving on to our Danville overview, we have a total positive case count of 1,477 to date, or approximately 3.4% of the Danville population, falling below the county positivity rate. Danville has done very well in sustaining and preventing the transmission of COVID. Also to note is less than half of 1% death rate, or total of 23 deaths, to include 15 residential care facility deaths or residents of a nursing or retirement home, and then 8 residential deaths. We're excited to see that Danville has vaccinated 33% of the population with first dose administration, and this number will only continue to rise and our downward trend to continue. Contra Costa County has set a goal of vaccinating 1 million residents by July. A total of 315,000 4 total doses have been administered, with nearly 100,000 or 10.6% receiving both first and second doses of either the Pfizer or Moderna vaccine. We're currently averaging approximately 7,000 doses daily. However, with the addition of the Johnson & Johnson vaccine this week, we only expect that number to increase, with the Contra Costa County currently the top performing large county in the state per our public health officer, something to be very proud of.
I would just like to add something to put some perspective. If you can go back to that last slide, keep in mind, the numbers are everybody looks at the numbers and shoot, if you're watching things these days, everything gets a little confusing no matter what you tune into. But just keep in mind, as you look at these numbers, we've got about somewhere around about a 75% of our population wants the vaccination. Keep that in mind, because that, as we look at 1 million vaccinations, you got to have people that are willing to get the vaccination also, right? The other part that I would point out is we have about 200,000 children that aren't in that group. So as you start to look at that goal of 1 million, we actually don't really need to hit 1 million, because we don't know how many people are going to actually, of the 25%, will change their mind, and we know some will. And I think you also have to keep in mind that the school age children at 200,000 under 16, that they have not said that this vaccine is recommended for. So considering the 315,000, I think is what we're at there, 315,000 doses, you can see we're aggressively on our way to be ahead of the curve of July. I mean, we're very optimistic if we keep a pace up, and you'll get into how many vaccine doses are available. That's going to be the real challenge. At the pace we're keeping, if they keep us at this pace, we'll be well ahead of July, which is great news for everybody to get back to normal. I just wanted to point out those numbers that we forget about. Thank you, Laura.
Thank you, Chief. It is exciting. All right. This next slide gives us a glance at vaccine distribution phases for Contra Costa County. So beginning in December with the Tier 1, as I alluded to earlier, including healthcare workers, residents of long-term care facilities, first responders, including firefighters. And then in January, we saw the vaccine initiative 75 years and older and law enforcement, followed by late January welcoming 65 years and older. Most recently, over the past week, we've expanded to agriculture and food or grocery store workers, and we are very excited to announce that our educators and teachers have finally made the list. At this time, I'd like to hand it over to Chief Aguiar to discuss our San Ramon Valley Vaccine Initiative.
And one last thing before Chief Aguiar takes over, just so the town council is aware, I know being a parent of college age kids and school age kids, getting back to school matters. I just want you to know, as we did with our police force throughout Contra Costa County, our fire district has agreed to vaccinate all teachers in the county. We will take the lead. We will partner. We have reached out and had great conversations with the San Ramon Unified School District, and they're excited about it. The way we were able to get our police officers, I think, vaccinated a little sooner than other folks was the fact that we were willing and able to take on the challenge of vaccinating the entire county's police force, for lack of a better term. You'll hear more about that as Chief Aguiar moves forward. Chief.
Hello, Mayor Morgan and Town Council. Thank you again for having us here. Now, as you all know, the plan for rolling out the vaccines was somewhat complicated. It became clear early on that there was going to be issues with distribution of the vaccine to the elderly and those in the lower socioeconomic areas of the county. Now, we're acutely aware of this issue because we are an EMS transporting agency. We understand very clearly how your age and/or your economic status plays a role in your access to healthcare. It's for these reasons that our chief and board of directors were actively requesting the ability to vaccinate countywide. We knew we had the personnel and equipment to send mobile clinics anywhere the county needed our help, and we expressed our desire to do so on numerous occasions. While we were lobbying for the ability to vaccinate countywide, Contra Costa County created the Ethical and Equitable Allocations Committee. This committee had 16 members comprised of county stakeholders. The task or purpose of this committee was to ensure a fair, transparent, and evidence-based approach to vaccine access during the early stages of availability, which we're still currently in. The county addressed the distribution issues through the following ways: mobile vaccine clinics like ours that I'll discuss more in depth later, outreach to community-based organizations, pharmacy partnerships, and they also established a support call center for scheduling vaccines. Now, it's very important to understand that we as a vaccine distributor are vaccinating citizens based on the priorities set by the county committee, the California Department of Public Health, and the CDC. We did not and do not decide who receives the vaccine. We administer the doses to whomever is eligible as set forth by county guidelines. Chief Myers, is there anything you'd like to add to this?
Yes, I think it's important to note that we understood when we volunteered, and it was made very clear to us, of course, our loyalties lie with our community and the district that we serve. But it was made very clear to us, and we made very clear to the county that we were willing to take care of any and all comers. And I think you'll see as we move forward, for us being ahead of that curve and being an active participant, I think allowed us to be more aggressive. And I think it benefited our community, but when the county gets back to normal, then we all get back to normal, as we well know. So that's the only thing I'd add. Thank you, Chief.
Next slide, please. Now, as you can see from this slide, we administer vaccines through two types of clinics. We have the drive-through clinics and the mobile clinics. To date, we have conducted 11 drive-through and 7 mobile clinics, vaccinating over 8,500 residents and employees of the county. And to break those numbers down even more, approximately 2/3 of our vaccines are going to out-of-district residents. Now, again, we do not decide who can sign up or register. We're given a total dose allotment for any given clinic, and County Health handles all the registrations for that clinic. And as you can tell, we're doing our part to ensure the county as a whole overcomes COVID faster. Now, it's also worth noting, but not shown on this slide, that not only do we host our own clinics, but we also have sent our personnel to drive-through clinics countywide. San Ramon Valley Fire is represented in some capacity as overhead, screeners, or vaccinators at every fire-based clinic since we started doing this in December. To date, we have conducted 18 of our own clinics, while the rest of the fire agencies in the county combined have done 13. I'd also like to emphasize that at the same time we were vaccinating with our mobile and drive-through clinics, we deployed 6 paramedics all over the state to fight COVID in the overcrowded hospitals of Inglewood, Bakersfield, and Stockton. Next slide, please. So as you can tell by this clinic, or by this slide here, this kind of shows you the differences in the dates in which we've conducted our drive-through clinics, which on here are called pods, which is a point of dispersing, and then our mobile clinics. And as you can tell from our first clinic that we held on December 30th, we were only able to vaccinate 261 people. This is the very first clinic that we did. We had no experience on how we were doing it, and we learned a lot from that first clinic. As you can tell by our third clinic, we had our system down pretty good. We improved our processes, our layout, and our operations. We increased our vaccinations by over 300 to 580 total vaccines for law enforcement officers within the county. Now, after finally getting tired of hearing from us, the county agreed to give us more doses for our clinics. We're able to get approval to start conducting clinics of 800 and up. And on February 25th, we conducted our largest to date at 682 vaccines. Now, county understood that we were capable, but also explained to us that they were having allocation issues and they couldn't give us what they didn't have. Next slide, please.
And let me just comment on that, because you got this. I like Chief Aguiar, if you can go back to the previous slide, because he puts it best. Once we, as the fire department, got the ability to take the battle to COVID, is which he said, and I agree with, we want to take it to him. And so Chief Aguiar, he wanted 1,500. He wanted clinics with 1,500. We didn't want to mess around with standing around. We wanted to get people in and fight this thing and be aggressive with it. So you can see 1,682. I was really proud, and they did a heck of a job. In 2 hours, they actually had about 600 people go through in 2 hours. They weren't messing around. So if they give us the capability, we can for a little department, I mean, mid-sized department like ours, we can do pretty well. So a lot of credit goes to that team.
Some of the challenges for our drive-through clinics, the first one I'd like to discuss is a standby list. And I'm going to go more in depth into this in the next slide, but the standby list is a pretty simple 4-step process. Until you start getting a lot of extra doses, the more doses that you administer, the more extra doses you have at the end of the clinic. And we're really going to get in depth into how we create that standby roster and how we administer those doses. So that way we do not waste one single dose at the end of our clinics. Another issue that we had was internal and external staffing. Internal staffing issues showed up pretty quickly once we started doing this. In order to vaccinate large numbers of people, you need large numbers of volunteers and paid personnel. Internally, we paused our fire academy. We reassigned them to the EMS division. We moved division heads and focused the district personnel solely on vaccination clinics. Externally, we focused on building relationships and collaborated with organizations throughout the county. Again, we're the organizers of the clinics, but this is a community-based effort. We've had people volunteer from the town of Danville, the city of San Ramon, volunteer organizations like CERT, Search and Rescue. We had communication reserves, firefighter reserves, and other fire agencies. At our last drive-through clinic, we had 60 volunteers helping to staff the clinic. This high level of participation really speaks to what sort of amazing community we live in, excuse me. Another issue that we had or challenge was, how do we do this for the long haul? How do we sustain this? Again, we knew we could potentially be vaccinating until July. And in order to accommodate that plan, we hired part-time employees, part-time vaccinators. So no matter what happened, we could still go out to the community and conduct our mobile clinics as well as our drive-through clinics. And again, unfortunately, something that we can't control is the allocation of vaccines. And this is one issue that we can't fix. We're optimistic now that with Johnson & Johnson receiving emergency use authorization, that it'll help increase our weekly allocation and we can start doing our first dose clinics again. Next slide, please. So our standby list. Our standby list has changed from our first clinic to where we are now. Now, the county put forth guidance on January 4th on how you were supposed to administer any leftover vaccines. The key to it was to ensure you did not waste one single dose because it was in such high demand. Everybody needed to get a dose. We weren't going to waste any of it. And currently our roster gets added to on a daily basis. If you or someone you know wants to join the roster, I'll walk you through the steps very quickly. Now, as you can see on the presentation in front of you, you simply need to go to the website, www.firedepartment.org, and click on the bright red banner or call the phone number at the top. Submit your information, and based on your age and tier requirements, you'll be placed on a position in the list. And we review these lists as best we can. You know, we vet and evaluate the list using our current medical director, Dr. Johnson, as well as our EMS coordinator, who's also a registered nurse, Laura Begin, who spoke previously. Our current list has over 1,300 people on it. However, it typically takes between 300 to 400 phone calls to get enough people to show up to receive the leftover doses. And those leftover doses can be anywhere from 50 to 80 doses, depending on how many we're administering. So as you can tell, this has gotten very time consuming. It's gotten so time consuming that now we'll call a day ahead of time and create a standby list for the standby list, just to ensure we have enough people showing up to receive those doses at the end of the day. And Chief, I don't know if there's anything you'd like to add to that.
Yes, I would. I would say this. It's real, and this has been one of the frustrations I think that a lot of us have had, is when this first started, our first two vaccines, there are a couple issues that you don't think about. And I'll just tell you, you didn't know when you had a vial with 10 doses that some of those vials have 11 doses. Many of them have 11. You don't, they don't tell you this part, right? We're the vaccinators, and it's not as of nobody's fault. They just have an extra dose in them, maybe for waste, maybe for some other reason. So we would have extra doses that we didn't know about. Furthermore, what you don't understand is people that get either nervous about taking the vaccine and don't show up, they forget, no show or otherwise. And so early on, our first two clinics, we were, I mean, our jaws dropped, but we're sitting there as just the vaccinators thinking that we have this plan that we've been given and they've given us our list. And all of a sudden, and I feel for my staff at 4:30, they think that they're at zero extra doses. And somebody from the county comes up and says, yeah, we've got an extra 40 doses. And now all of a sudden we're scrambling. So that's what led those first two. That's what led us to get the word out about vaccines, both social media, word of mouth, trying to get the information out as best as we could. And so now we have a position where we have the standby list. And I would just like to say this standby list is actually, for those folks over 75, it's actually caught those over 75 that couldn't get an appointment. Because as you all know, and I'm sure you've heard, there's frustration, you're trying to get registered, there's all kinds of issues. So this standby list, a lot of credit goes to my staff, for putting this together, having our medical director vet the system. But again, it's not perfect. And when you call 300 people to get 20 or 30 folks and people who are on the standby list say, oh, can I come tomorrow? It gets frustrating, right? So I just want to give a lot of credit for their patience, their ability to stand the test of time and continue to do this and get this word out. It's very important. And what we've done is, in a weird way, as frustrating as it is, we've been able to forecast the next group and be able to get them through as well. So we've actually moved ahead effectively for the next group that's on the list. So I just put that out as some clarifying factors.
Next slide, please. So the next thing I'd like to talk about are our mobile response team vaccination clinics. Now, as discussed earlier, equitable distribution is an issue that we take very seriously. It is the direction of the fire board and the chief to make mobile clinics our top priority. Now, collaboratively with county health, we are vaccinating the senior housing facilities throughout the county, not just in the district, but throughout the county. Our first clinic was on January 28th, and we've done 6 since then. Our goal is 2 per week, but that is dependent upon how many county health can schedule for us. Also, keep in mind, we go where the county health needs us to go. We don't determine the location for these mobile clinics. They contact us and they let us know that they have a location wherever that may be, and we'll show up and make sure that we vaccinate everybody that's there. Now, as you can see, we have conducted mobile clinics starting in our own district. We started in Alamo, we've done them in Danville, and recently we've been going out to Antioch, Richmond, El Cerrito, and Hercules. And as of today, we completed 2 more clinics in Pittsburgh. Now, virtually all these clinics inside and outside of the district are attended by our medical director, Dr. Johnson. Next slide, please. Like the drive-through clinics, our mobile clinics also experienced some challenges. Now, one of those first challenges, the main things that we had to overcome, was a lack of trust in the COVID vaccine. Some communities wanted to get it, and frankly, some didn't. Some didn't want anything to do with it. And we've had to solve that trust issue very quickly in order to be effective in doing this. And our ability to do that really speaks to why the district stands out, and that's our ability to bring in our own medical director, Dr. Johnson. He is present in all of these clinics to help educate those who are hesitant and distrusting of the vaccine. And while at the clinics, he's able to have one-on-one sessions with folks, educate them, understand why they're hesitant, and eventually get them vaccinated. Having access to our own medical director has really helped to make these clinics, with both mobile and drive-through, the success that they are. Another issue that we had is these are unfamiliar locations. We have no firsthand knowledge of what this senior housing apartment may be. We have to show up and adjust on the fly with whatever the situation is. But something that we take pride in is that we bring everything with us. We're like a traveling show. Once we show up, we have everything we need. If it's not provided by the county or by the facility, it's not a big deal because we either have it in our ambulance, we have it in our van, or we have it in our box truck. We're ready to and prepared to vaccinate everyone on site if need be. Another challenge that comes up is the registration of patients. And this is a big challenge. A lot of the elderly and poorer communities don't have access to computers, smartphones, or even email addresses. And if they do, they don't really know how to use them good enough to be able to register for a vaccine. There are also communication barriers. English is often a second language. And on top of that, a lot of these folks have medical conditions and they have somebody else making power of attorney decisions for them. So you have to contact those people in order to get them to sign off for them getting the vaccine. Again, working diligently with county health and the housing authority to overcome this issue. Next slide, please. Some of the next steps, where are we going right now? So currently we have a clinic set up for this Thursday, March 4th. This is our last second dose clinic of the month, but we're currently working with county health to get more March dates solidified. Now, the good news is currently we have over 80% of our 75 and up age group, and over 55% of our 65 and up age group have at least been given 1 shot, provides them some level of protection. But we're still having very real issues with vaccine allocation. The county is getting less doses over the next few weeks. Storms, shipping delays, and larger allocations to bigger facilities like Kaiser have limited the amount of first dose vaccine clinics that we can administer. Another thing that we're making sure that we do and we stay on top of is our CDC recommendations. These change frequently, but through collaboration again with Dr. Johnson and our RN, Laura Began, that we have on staff, we always have a good plan in place to handle any of the COVID-related medical questions or issues that may come up. we're always consistently ensuring that we have equitable distribution for these vaccines. We're always looking at our processes. We're always looking at better ways in which we can improve in what we're doing, with the goal of getting these vaccines out as quick as possible. We're here to work with the county. We're here to do what we need to do to be able to make sure, like Chief mentioned, to get the county back to normal as quick as possible. And we're going to make sure that we do our part in that. Chief, if there's anything else that you want to add, that's all I have at this time.
Yes, thank you, Chief Aguiar. So that wraps up our presentation. I would just like to say a couple of things just for clarification. We're very happy to partner with the county. The county has been a great partner as we talk about these issues and the ups and downs of these issues. It's very important that you understand that that this is new for everybody. And so we're very appreciative of the county letting us partner with them. And we went through these ups and downs. We just wanted to kind of paint the picture, because people see all these stories that are 2-minute stories on the news, and they don't know some of the integral parts of it. So for us, great partnership with the county at this point in time, great partnership with the school district, the police departments, and really the town of Danville. We're proud to serve you, and we're proud to have done this. And I've got a great staff. I don't do a lot. They do all the work, and I'm just proud of them. So with that, we'll take any questions that you might have.
Thank you so much. We'll go ahead and take questions or comments. I think Newell's got his hand up.
Boy, Chief, you guys are just rock stars on this. You guys have really hit home runs every time you've organized this. I wish you guys could get, 1,000 or 2,000 a week to do this, because your system, your experiences have really, really paid off. And everybody I've heard that have went through your process have all come out to say the same thing: best run system around. So really, just thank you on behalf of the community. You guys are always pivoting. You're always at the forefront, and this is no different. So well done to everybody. Thank you.
Thank you.
Karen?
Yes, thank you. Since a lot of us have firsthand experience, and I know our block, which comes out at equidistant far away every Friday to see who's still on the block, they're all done. And it's because of your clinics that they're done. And it's just been outstanding that people feel so much more confidence. They're not all done with the kids and the younger people that haven't qualified, but those that have qualified for it can't stop talking about your success. And I know I called you one night about that, because it's just indescribable, the fact that we have firefighters that are also EMT, and the confidence that builds in people, that they know that if something happened out there and they had a little seizure or something, that you'd be there to take care of them, made all the difference in the world. And so you're right, it does matter, the familiarity with the site. And I just wanted to reinforce how confident they are when they see you there, and that your staff has been absolutely outstanding. Thank you.
Thank you.
Anybody else? Robert? You're on mute. Robert, we'd love to hear you if you'd unmute yourself there.
Wow, that's got to be the rookiest move of all right there. Chief, I want to thank you for all your good work, and Jim and Jonas and Laura, thank you. I've heard that the people that have gone through the drive-through are very professional, very efficient, wonderful bedside manners. I mean, it was just really complimentary to the good work that you guys have completed in the community and helping us get through all this nightmare. And, and I appreciate that. So we're getting closer, and there's light at the end of this tunnel. We just got to get to the end of the tunnel. And, and by all of the good work you're doing, it'll get there a little bit sooner. And now we see some end in sight. And, once again, I take my hat off to the entire Fire Protection District and all the wonderful work that you do in the community. I mean, it's a lot more. I mean, I know fighting fires and medical issues and all the things, but, there's a personality to the fire district that relates real well with the community. And that's important. Nicely done. Really well done.
Thank you.
Dave?
Hey, Fires, congratulations to your team for what they do. And and it's within my company, and I say it all the time. It's not you or I. We're all in it together, and it didn't take you an ask. You and your team stepped up and said, we need to not only commit, but we need to deliver on that commitment of protecting the health and safety of our community. And this is what we're going to do. Small part, but it's a model that we need to embrace, because as you know, going forward from 1B to the next level of population, exponentially that population goes up that needs to be vaccinated. And we need folks to be ready not to vaccinate, but to be within proximity of our community to be available and accessible for those vaccinations as well. And there's a huge effort going forward, but you've taken on the challenge, and I think in turn have challenged many of our healthcare professionals, if not our community, to step up to look for ways that we can really vaccinate our community and do it in a way that we really can move that needle quickly. And I do agree with you. I think the J&J product is a game changer. It's a one dose. There's going to be a lot more available. That's a lot more consumer friendly. And it's, I think, a product that will be in the distribution pipeline very quickly. But once we have enough, then we need to have folks giving those vaccines as well, but giving the vaccinations as well. And I'm just really proud of what you guys have been able to do. And on behalf of the community, thank you very much.
Thank you.
So I'd like to wrap it up by saying, there are so many times we look around and we look for heroes in our community, and we try to figure out who do you pat on the back, or who do you say thank you to? And when I think of that, I think of the four of you on this screen that have made this all possible. You didn't just sit back and wonder or wait for somebody to say, this is what we need to do. You all took the bull by the horn and made it happen. And thanks to you, those numbers are going down, and life might just get back to normal before the end of the year, if I knock on wood hard enough. But I want to thank each and every one of you, not only for being here tonight, but for all that you do for all of our residents, not just in Danville, but for entire Contra Costa County. Thank you so much.
Thank you, Mayor. Thank you all. Appreciate it.
And thank you for being here this evening in the presentation. We really appreciate it. Thank you.
Thanks, guys. Take care.
Have a great night. Thank you.
So item number 6 on our calendar, is kind of hard to follow that, but item number 6 on our calendar is our consent calendar. And the consent calendar are items that are considered routine and acted upon by the town council in a single action. And to address the town council on a consent calendar item, you just need to push the raise your hand feature on the option in Zoom, and we will announce your name, and you have 3 minutes to share your comments. Is there anybody right now that is wishing to address the council on consent?
There are no requests to speak on the consent calendar.
Okay, so I'll bring it back to the council. Is there anybody in the council would like to remove something off of consent? All right, seeing none. Do I have a motion?
Make a motion to approve the consent calendar.
All right, I have a motion, a second. Marie, would you mind doing the roll call?
Yes. Councilmember Fong.
Aye.
Councilmember Stepper.
Aye.
Councilmember Storer.
Yes.
Vice Mayor Arnerich.
Aye.
And Mayor Morgan.
Yes.
And the consent calendar was approved unanimously.
So once a month on item number 7, we have the opportunity to listen to our town manager and listen to what's going on in our wonderful town of Danville. I'd like to welcome our town manager with his town manager's report, Joe Calabrigo.
All right, well, thank you, Mayor, members of the town council. Great presentation by our fire district folks. Tough act to follow, as you say. I guess I would point out that so far, eligibility for the vaccine has probably been about the only positive that I've been able to come up with from having recently turned 65. But at least there's that. So I'm appreciative for all they've been doing for us, both with the vaccine and the outstanding work that they do. So I want to start my report this evening with a little bit of good news. We're joined tonight by Marcel Indelicato. Marcel is joining us to step into our emergency services manager role. I know that all of you were very familiar with Marcel's predecessor, Jeff Hebel. Jeff's retirement last month created an opening, and we were very fortunate to be able to connect with Marcel and bring her on board. Her most recent experience involved serving as an emergency services planner for the Contra Costa County Office of the Sheriff. Her background is interesting because it's both in healthcare and in emergency planning. So unlike the person that she's representing, although she worked for a law enforcement agency, she doesn't bring a strict law enforcement background to the position, but she does bring with her a wealth of knowledge and experience in all of the areas where we need it. And after a very short period of time, she's already hitting the ground running. And so I wanted you to be able to put a face with the name and introduce Marcel to you and let you know that update training for our town council is certainly on Marcel's list of things to do. So it's my pleasure to introduce you to Marcel Indelicato. And with that, I don't. Not assuming we have any questions for Marcel yet, because she's still pretty brand new. But I wanted you to get to know her a little bit, so that the next time you see her in front of you for some specific reason, you will know who this person is.
Thank you, sir.
Yeah.
Welcome.
Thanks for being here, Marcel.
You're welcome. Good evening, all, and have a good one.
Great, thank you. You
so,
too.
Usually my monthly report starts with the COVID update, and I'm after the presentation that we've just had, I'm going to be I'll be a little bit briefer and try not to repeat anything that you've already heard. We're coming up here in a couple of weeks on the first anniversary, 1 year of coronavirus and the declaration of a local state of emergency here in Danville. The town is doing its part to continue to respond to the pandemic as one of the many agencies here in the San Ramon Valley, and the coordinated effort that's been rolled out by government at federal, state, and local levels. For us, we are continuing to assist with implementation and enforcement of the standing health orders, continuing to do what we can do to push out information, help keep our community informed. Of course, doing a lot of work supporting our local businesses and residents, while continuously having adapted the services that are provided through the town government so that we can work within these health orders and make sure at the same time that we're keeping our workforce, our staff safe. As was alluded to earlier on, since peaking during the third week in January, the number of new COVID cases and the positivity rate has been in steady decline. So in Danville's case, we look back over the past month, and our numbers of new cases have declined by about 80%. So they're now equivalent to about where they were mid-November. So that's good news. As of yesterday, with I think 48 new cases in the last 14 days, we were at our lowest point during the 2021 calendar year. Since the end of January, all of Contra Costa has been operating in the purple tier under the state's blueprint for a safer economy. As of today in California, we have 40 counties that are continuing to operate in the purple tier. We have 16 counties that are operating in the red tier. That's an increase of 7 from last week. So we went from 9 to 16 in the purple tier. And we have 2 that are operating in the orange tier. So here in the Bay Area, we've got Marin, San Francisco, San Mateo, Santa Clara that are operating in the red tier, and Sonoma, Solano, Contra Costa, and Alameda that are still in the purple tier. So the big question, of course, is when we can expect to move to the red tier. And as was alluded to by our friends from the fire district, our current positivity rate is well below the threshold to move to the red tier. So if we sort of project out the continuation of the same downward trajectory that we're seeing in the number of new cases per 100,000, we expect to be in a position to move back to the red tier by the middle of March. And so what does that mean? Well, in addition to the businesses that are already able to operate at the levels that they're operating at now, it means that restaurants can begin to once again offer indoor dining, albeit at 25% capacity. Retail can increase from 25 to 50% capacity. There are additional personal care services that are going to be allowed to reopen following the state health guidelines. Gyms and fitness centers are going to begin to reopen on a limited basis for indoor operation. That's limited to 10% of capacity. And then churches are going to be able to reopen indoors at 25% capacity. So until then, we want to do everything we can to continue to encourage our community to follow all of the appropriate safety protocols, maintain their social distancing, get their vaccines. I think we're all very proud of the fact that, in Danville, I believe that we are second only to Walnut Creek as among cities in the county in terms of folks that have either their first and second dose of vaccines. So we want to encourage that to continue. If I move over on to economic development, as I mentioned, supporting our businesses has been a big focus for the town during the pandemic. Council is continuing to get the weekly updates from Liana Adauto, and we're continuing to provide assistance and support our businesses as we have throughout the pandemic. Just a few highlights: our Forward Focus Business Grant Program. Council has earmarked $525,000 to assist qualifying retail, restaurant, and personal service businesses with grants of up to $5,000 apiece to support their recovery efforts. So far, we've had 147 applications for those grant funds. We have funded 110 of them so far. We still have funds that are available, and so we're encouraging businesses that continue to be interested to reach out to our economic development staff through the town's website. When we combine the funds that have been provided for the Forward Focus Business Grant Program with other funds that the town has committed, so far we've committed just over $900,000 to supporting our businesses here. We're continuing with our free business assistance program that provides one-on-one support to our businesses, including helping them qualify to receive state and federal funds. There are 57 businesses so far that are receiving support through that program, where we're partnering with Townsend Public Affairs. Townsend is also offering weekly webinars to businesses to help educate them and further their understanding of what funding is coming down the line and how they can prepare to access these funds. We have been conducting what we have referred to as First Friday webinars that you're familiar with. What we're finding now is that updates have become available from other sources, we've seen the participation in that program decline a bit. So we've moved away from those webinars and we're relying more on weekly emails to businesses to communicate the types of resources that we have available for them and to keep them in the know in terms of what's happening both locally and at a state and federal level. In lieu of the First Friday webinars, we've been sharing other webinars such as the Townsend webinar that I referred to just a moment ago, and also webinars and training that are available through our own Danville Area Chamber of Commerce. Tri-Valley Restaurant Week was took place between the 19th and the 28th of February. This was a 10-day, I guess you'd call it a culinary celebration that highlighted over 40 restaurants and wineries in the Tri-Valley. and featured some limited time specials and discounts that were coupled with an interactive mobile pass where you could get rewards for participating. We had over 2,600, we had about 2,600 participants in the Valley, and about 325 were from Danville. We are now working with Visit Tri-Valley on a new campaign that's called To Danville with Love. This is going to be a regional marketing campaign. 4 of the 5 cities in the Tri-Valley are participating at this point. The whole idea behind the campaign is to basically reintroduce, it's a regional marketing campaign that's aimed at reintroducing people to their local communities and getting residents to fall back in love with their community and with their region. So it's going to provide opportunities for residents to rediscover their hometowns, show support for their local businesses. We're going to be using some of our current business promotion funding to support this 3-month campaign. And Visit Tri-Valley is providing matching funds. So we're leveraging our dollars and achieving more buying power to further the reach and success of this campaign. As a reminder, we are offering this year, we're offering free employee parking permits for our employees that work downtown. And, you know, we want to make sure that, that our businesses are aware of these. Parking enforcement, we used the entire month of February to reach out and remind businesses and folks that are parking that we're going to start issuing parking citations again in the month of March, because there's a lot of activity downtown. Things have picked up considerably, and we're going to begin to refocus our efforts on turning over available parking spaces for customers and patrons of our businesses, our restaurants. And as a result of this outreach campaign, we have seen a pretty significant uptick in the number of new permits that we've issued. Of course, our own staff is continuing to do everything that they can to make sure to push out information about changes that are coming from the state and the federal government, to the various programs that are being offered that provide business funding and support, whether it be in the form of PPP loans or other types of funding. We're keeping our businesses up to date in a number of ways through weekly emails, websites, website updates and the like. So, and finally, of course, we're continuing to put out messages to our community, continuing to urge our residents to support our local businesses by buying and shopping locally. So Jill Bergman, Liana Adauto, and their team, and working with Judy and the folks at the Chamber, very, very busy. And I think based on my conversations with my colleagues throughout the rest of Contra Costa County, I think that we can say that we're doing as much or more as any other city in Contra Costa County. So switching subjects again, we are having come through now the mid-year of our budget. With that now in the rearview mirror, we're in the early stages of beginning to put together a draft of the 2021-22 operating budget and capital improvement program for the council consideration and review that'll be starting coming up in May. We're of course continuing to very carefully monitor our budget with respect to impacts that are being generated by the pandemic. Those same impacts that necessitated a reduction of $7.2 million over a 15-month period. But as we know from Council's review of the mid-year, we are meeting and exceeding our budget forecasts for the current year. And we're confident that we are going to close the year within those expenditure and revenue targets. And as we look toward 21-22, begin to see some, not all, but some of the services that have been impacted as a result of the pandemic begin to be restored. And I would expect that you'll see those things phase back in over the next 1 to 3 years. While we are continuing to operate under the declared state of emergency as part of the budget, we are, of course, also looking forward to seeing the various ways that we can take the experience that we've gained through the pandemic, lessons learned, and apply those toward delivering better service to our residents once the pandemic abates. And, this is going to include things like how we conduct our public meetings, how we engage in our efforts for community outreach, permitting and conducting business with the town, keeping our own employees safe, and space planning for our town facilities and the like. Switching over onto the legislative front, our council legislative subcommittee met on February 23rd. The immediate focus for our advocacy work continues to be to support the legislative efforts that assist with pandemic recovery at the state and federal level, and also to try to impact and limit new legislation that impacts our ability to make local land use decisions locally, and things that add stress to the town's already impacted resources. So our legislature has been a busy group. They've introduced 2,300 new bills for this session. Just to put that into context, it's an average of 20 per legislator. So I don't know whether that's something that they have on their check list to tick off, author 20 new bills, but on average, that's what we are dealing with. We have, of course, a myriad of new housing bills that have been introduced ostensibly to promote affordability by, among other things, eliminating single-family zoning, allowing for residential development in non-residential zoning districts, and providing some windfall density bonuses in exchange for what I would characterize as fairly minimal affordability. The good news is, from what I can see from monitoring some of our local social media platforms here in the community, some of our residents are beginning to take note of what's happening up in Sacramento. They're becoming more cognizant of that. So that's a good thing. We do anticipate that much of our legislative effort this year is going to be focused on weighing in on all of the new housing legislation. Along those lines, Council has already spent quite a bit of time talking about the 23 through 30 regional housing needs allocation process that is being administered by the Association of Bay Area Governments. We all know that ABAG is looking at a 4-fold increase in Danville's numbers from the last cycle, from about 550 to somewhere in the neighborhood of 2,200 housing units. So it is going to put us into a situation that I could describe at best as challenging, and if I wanted to be less charitable, I might say untenable. But we're going to have to go through our 23 through 30 housing element process here in the next year, and see if there are answers to be found for some of these challenges. And Council is going to be at your meeting next week, your study session. You're going to be finalizing the approach for various ways of making sure that we're informing and engaging our community on this process. Police services, I'm happy to say that the chief will be with you in 2 weeks, and he's going to present his annual report. I think the highlights of what's going on right now. The crime numbers in 2020 were again at an all-time low. He's continuing to do his weekly 10/8 outreach via Facebook Live. And so I'm sure that you're all looking forward to hearing from him in 2 weeks. Development services, a lot of activity going on, continuing to experience a very high level of permit activity and building services. Work is continuing on the development of the new townwide bike master plan and the design of the Diablo Road Trail project. Starting work on the 23 through 30 housing element that I alluded to just a moment ago. Again, the goal there is going to be to have an adopted housing element to submit to the state by no later than January of 23. Our CIP staff is working on their updates to the 5-year CIP that'll be presented to the council as part of the operating budget in May. And of course, we were all very excited to be on site and see the new San Ramon Creek footbridge installed at the town green back on February 11th. We expect to have all of the accompanying abutment and pedestrian work completed by the end of March. In maintenance, we're in the midst of a drought. We've still only seen about 7 inches of rain for this year versus the annual average of 22 inches. And for those of you that are keeping track, that annual period that we're tracking is July 1 to June 30. So, we get out of the month of March and into April without seeing a lot more rain, and it looks to be a very, very dry year. Our staff has completed recently all of the pruning of all of the 1,500 roses at rose bushes at Osage Park. They just got through pruning the 220 crepe myrtle trees. They're working on a plant replacement project on El Capitan Drive. They're in the process of rebidding our townwide parks maintenance contract. So you'll be seeing that before too long. The good news is we got 5, I think, well-qualified bidders. They're also in the process of getting a bid to convert one of the tennis courts at Osage Station Park for pickleball. This last weekend, we saw the annual winter sports field and dog park moratorium lifted. We're now into March, and so unusually for the town, usually the weekend we are ready to lift the moratorium. We have a storm in, it pours like crazy, and we end up carrying over the moratorium for another week. Not so this year. So folks were able to get back out there and enjoy their fields and the dog parks. And just a couple of other things to highlight. East Bay Municipal Utility District has told us that they're going to be closing the public parking lot at the Castaneda pumping plant there at Sycamore Valley Road and Camino Tas for about a year, starting in May. So they're going to be using it as a staging area for work that they have to do to upgrade and improve the water distribution system. Just FYI. The Sports Alliance is going to be bringing forth a proposal to the Parks, Recreation and Arts Commission to at Sports Alliance expense, light the one remaining unlit field at Diablo Vista Park. So they'll be bringing that proposal forward to the Parks Commission, and it may very well at some point land in front of the 5 of you. And then at the request of the Parks, Recreation and Arts Commission, our staff is obtaining costs to renovate the remaining shed structure at mcgee Ranch Park, that which is adjacent to the Bounty Garden. So that's maintenance, recreation. Our director, Henry Perez Alonso, was here just 2 weeks ago to present you with his department update. Their staff, they're continuing to provide the community with opportunities to decompress, if you will, in various ways, and try to find the fun within activities that are being offered both online and in person. Our spring activity guide is out in mailboxes, can also be viewed on the town's website simply by clicking Find the Fun on the front page. Where you can go to find information about online registration for all of our programs and activities. And then just a couple of things coming up. I'm sure she will touch on this, but as part of our outreach and engagement efforts, the mayor's new Town Talks program is going to premiere on Friday, March 5th at 9 o'clock. She's loaded up with some pretty interesting guests this week. She's got Dr. Savelli, from the health department, Chief Paige Meyer, and then also the CEO from San Ramon Valley Regional Medical Center will be there, and they'll all be talking some more about the vaccine rollout. The council is going to be meeting with each of our 4 town commissioners and 2 boards during the months of March and April to talk about priorities and issues of interest to each of those. And I know that we also have the mayor's State of the Town coming up, and that'll be presented as part of the Danville Area Chamber of Commerce program on April the 1st. And you can get more information about that by going to the Chamber's website. So I'll conclude there. For any and all who are interested in all of the latest news and information from the town government, please go to our website, check our website, www.danville.ca.gov, and subscribe to any or all of our latest updates. So with that, I'll conclude my report and take any questions. Thank you.
Thank you. Thank you so much, Joe. Always so thorough. Is there any questions from council or comments? All right. Well, you know what? When you cover everything, it's difficult to ask questions. So we want to thank you so much. Robert, did you want to add something?
Yeah, just a comment. As always, we're really appreciative of Joe's updates literally each week on COVID. The executive summary part of it, he breaks it down so it's easy to take that information and move it forward. So, thank you for doing that, Joe. That does make it really helpful. And the information is really well received in the community.
Very welcome. Thank you.
So moving forward, thank you so much, Joe, for everything. And we look forward to hearing from you again next month. I'm sure you'll have more to report back to us then. We'll go ahead and move on now to item number 8, which is 8.1 is our Southwest Area Transportation Committee semi-annual report. And that would be Councilmember Stepper.
All right, I'm actually reporting on a couple of different meetings that have gone on because I'm also on the 680 Innovate plan, and we had a long meeting. So just talking about the updates we all know about with the different strategies for the corridor, because, we did go through an election recently that will show up again on Innovate 680. Which will be thought out in a different way, I think. But the parts of it and the bus on shoulder and things that we've discussed before that are happening in other communities and what that makes possible for us were brought up. So I don't want to go into all of those details. And I know that Newell earlier had talked about completing the express lanes being such a great part of that already happened this year. But the meeting we had last week talked about Vision Zero. And this has a lot to do with the part that we spent our time on was the bicycle plan this time. And so they're working very hard to bring this up. They had a big, long report that had been put together by Farron and Pierce. I'm probably not pronouncing that correctly, sorry. But it was interesting to me that we spent the time mostly on pedestrians and bicycles with a lot of statistics. So there were a lot of questions on those statistics. Mr. Clark gave the report. There were a lot of questions on the pictures and how they were relevant, including the amount of collisions with a bike or collisions with a car, because we didn't understand how race would be indicator. It's not really. So he's going to go back and look at that because if so, we said, we're going to put our money where people are having the most problems and the most severe accidents. So I offered the fact that Danville was in fact committed to a bicycle plan at this point, and that we're working really hard to make our bike safety so that we don't have any deaths or any severe injuries, which is what this zero is all about. And that Al Kalin has helped us with the idea of looking in great detail with the police department. Even on that very small accident that happened recently, I was surprised that he was right on that. He says, yep, I look at every accident because you want it never to happen again. And so you have to understand what made it happen. And that's not necessarily what the outlook is of some of the emergency people. They're trying to get everything going on the roads, on transportation, and they're trying to get you off and wherever you need for treatment, as opposed to how do you make sure that that accident doesn't happen again. And so Candace was informed about that too at that meeting. So that was interesting to her because she had some good comments on this report. So I think that's going to be important because I think it's going to dovetail with what we're doing. but it's important for the county because this is, of course, the county-wide regional committee outlook, that this is what's going on with this civil report, and that it was a well-done report. It just needs, it happened to have been created a while back. And so it's going to have some changes to it before it comes back to us.
Well, thank
So
you for that.
thank you. And Dave's been coming as the alternate too. Thanks,
great.
Dave.
Great. So any other comments or anything? So we'll go ahead and move on to 8.2, which is a Tri-Valley Transportation Council semi-annual report, which I'll refer to as the TVTC. And I have a report pretty much for the past 6 to 9 months. We haven't had a report. So they've continued to work on the development of the Tri-Valley Transportation Fee Nexus study. The study will wrap up in spring, and they'll move into the launch of the development of the new strategic expenditure plan that will set a new Tri-Valley transportation development fee rate. And that will serve as the funding plan for the new list of projects for the subregion. The effort's going to take about 9 to 12 months to complete. Councilmember Stepper mentioned Innovate 680, the new proposed strategic expenditure plan. Projects include CCTA's Innovate 680 projects, several projects serving bicycle and pedestrian connections to and from the Iron Horse Trail, and the Valley Link rail project, and technology enhancements to connect local arterial roads with the I-680 and I-580 freeways to connect and for connectivity and also for autonomous vehicles. In October of 2020, since we haven't had a report for a while, the TVTC presented a proclamation recognizing recently retired Alameda County Supervisor Scott Haggerty for his 25 years of service and contributions to the Tri-Valley Transportation Council. And that's pretty much a wrap for the last 6 to 9 months of what TVTC has been doing. Okay. Are there any Danville council member reports or any updates? All right, I look forward to seeing everybody on Friday, 9 a.m. bright and early, and for our first program. And please feel free to submit your ideas. I'd love to hear from you. We're going to be doing this on a monthly basis on the first Friday of every month. So with that, I'd like to say thank you for being here this evening with us, and this meeting is adjourned.